Sophie, if you're ready, we can start. Excellent.
Okay.
All right. Good morning, good afternoon, good evening, everyone. My name is Panya Yu. I work at the UN Statistics Division. I will be moderating this webinar today with my colleagues, Sean Lowell and Alexander Loschke. This webinar is being organized by the Global Network of Data Officers and Statisticians. We are an online professional network with about 3,200 members that use our platform to share best practices and to support each other in all areas related to official statistics. If you're not a member already, I definitely invite you to join us. I will post the link to the global network after this introduction. So today it's a real pleasure to have with us Sophie Mitra of Fordham University and the Disability Data Initiative. Sophie will present on using household surveys and population censuses to monitor the inequalities that affect persons with disabilities. The goal of this webinar is to share recent developments and highlight research opportunities related to the situation of adults with disabilities worldwide. Based on recent results from the Disability Data Initiative, which Sophie will talk about later, she will discuss three topics. First, she will talk about the various approaches to collect and analyze data on disability in household surveys and population censuses, in particular with respect to the types of questions used and how to analyze answer scales on severity. Furthermore, she will present how and where questions on functional difficulties using the internationally tested Washington Group Short Set or similar questions have been adopted around the world. And finally, she will present results of analyses of the demographic and health surveys and census data on whether persons with disabilities are being left behind, using the example of 15 countries. Let me now introduce our speakers. Sophie is Professor of Economics at Fordham University in New York City, and she is also the principal investigator of the Disability Data Initiative. Her research agenda has documented economic insecurity and evaluated policies that try to reduce it. A central line of her work consists in producing evidence to document disability inequalities through disaggregated statistics and to understand the factors that drive them. Sophie received her doctorate in economics from Université Paris-1, Panthéon-Sorbonne, and we are very pleased to have her. Before we start, just a few housekeeping rules. We will hear the presentation before having a Q&A at the end. As I mentioned, feel free to write any comments or questions in the chat box during the presentation. And during the Q&A session, we will allow microphone and cameras so you can also ask your questions directly to Sophie. As always, this Global Network webinar is being recorded and will be made available later at the Global Network at jammer.com/UNstats. We invite you to continue the discussions on the Global Network after this event. Now, with this introduction out of the way, let me turn the floor to you, Sophie. We look forward to your presentation.
Thank you so much, Panya. Thank you for having me. And thank you to all for being here at this busy time of the year. So I'm going to share my screen. I'll be using some slides. If you have any important clarification question, feel free to use the chat. I will not be monitoring it, but Panya, maybe let me know if there is any major clarification that's needed.
Sure.
Okay, do you see my slides now?
Yeah, it's on now.
Okay, good. I will go to play. All right. Okay, so I will present on using household surveys and population censuses to monitor inequalities for persons with disabilities and results from the Disability Data Initiative, we acknowledge funding from the Wellspring Philanthropic Fund. So as background, disability is remarkably common. There have been lots of studies in the past 15 years showing that it affects a lot of children and adults. So a recent study by UNICEF shows that it's 1 in 10 children worldwide with a disability. And for adults, it's the latest estimate, global estimates is 1 in 6 adults. But first, what do we mean by disability? So conceptually, there has been a move away from a medical understanding of a purely medical understanding of disability towards an interactional understanding of disability, meaning that disability is thought about as a person with a health condition interacting with their environment, and their environment is the physical environment, the sidewalks they walk on in their neighborhood, whether they are building their buildings, office buildings or apartment buildings have elevators or escalators. It also covers the social environment, the attitudes of people, and the policy environment, the laws and policies in place in their countries and cities. So this environment interacts with the person and their personal characteristics like gender, for instance, or age, and leads to sometimes to some restrictions in how much the person can participate in society or in the activities that the person can do. So this is this is a common understanding of disability nowadays, an interactional one. And of course, disability has increasingly been understood as a human rights issue where every person has rights. And for persons with disabilities, these rights are spelled out in the United Nations Convention on the Rights of Persons with Disabilities that more than 180 countries, I think it's about 186 now, countries have ratified, and many countries have their own disability rights legislations also. And a major focus of these legislations or the convention is to remove barriers in their environment or resource limitation that can affect the lives of people with disabilities. And finally, disabilities understood as relevant to everyone, universally relevant. So if someone is not disabled currently, there is a high chance that at some point in their life they will be disabled. So it's not a phenomenon that affects a small minority. It's widely relevant. It's relevant to all of us. So in that context, producing national as well as subnational statistics on the situation of persons with disabilities is very important. It's important to monitor the implementation of the Convention on the Rights of People with Disabilities, but also to monitor the 2030 Agenda for Sustainable Development and whether people with disabilities are being included or left behind in this agenda. However, there is a lack of information on the inequalities that persons with disabilities face, and national statistics offices increasingly collect data on disability, but rarely disaggregate statistics by disability status. And often we find that survey or census reports give results on prevalence rates, so the proportion of a country's population with a disability, but does not go any further into disaggregating statistics like employment rates or poverty rates. So the Disability Data Initiative provides analysis of disability data to help advance the rights of persons with disabilities and sustainable human development for all. The website is https://disabilitydata.ace.org. Fordham, Fordham.edu. So the Disability Data Initiative produces reports every year in which it maps the availability of internationally comparable disability data, and I'll explain what that means shortly. By reviewing data sets and their disability questions globally and across world, region, and over time. And it also produces disability prevalence rates and disaggregated indicators such as educational attainment indicators, employment population ratios, multidimensional poverty rates. So I'll give you some of the results in this presentation, but I'm going to be focusing on 6 particular issues. One is disability questions, what questions to use in surveys and censuses. Then I'll show you an overview of the censuses and surveys questionnaires we reviewed and the availability of data. How to categorize disability, where to set the cutoff when we have graded answer scales to disability questions. And then the big question, are there some data sets that are better than others? Are surveys better than censuses when it comes to producing disability disaggregated statistics? And then 2 questions about feasibility. Is disaggregation by disability and other characteristics such as gender or age group feasible? And finally, is disaggregation at the subnational level feasible? And I want to note that because what I'm going to present comes out of the work of the DDI in the past 3 years. There is still much to learn, and on some of these questions we are still learning. So I look forward to the Q&A to have your feedback and expertise and views on some of these questions. Okay, so the first questions, what are the disability questions that we find in surveys and censuses? Are there some questions that do a better job than others? Well, first of all, the type of questions that we find in surveys and censuses, often it depends on the goal of having such questions, and the goals for such questions can vary tremendously. So the data on the just prevalence rates, the proportion of a population with disabilities or inequalities, can be used for resource allocation in a country. It can be used for advocacy by organizations of people with disabilities or people with disabilities themselves and their allies. Can be used to inform programs and policies. And it can be used, of course, for research, for impact evaluations and more research agenda around disability. Now, how does one measure disability in population-based surveys? They are assessments by survey staff or versus self-reports where the respondent, the individual respondent or the household respondent is going to answer some questions about their own disability or their household members. So assessments by survey staff tend to be quite resource intensive and very rare in surveys or censuses. So we'll focus on self-reports. So that's been our main focus. So self-reports, there are different types of measures, and I list a few here that I'll go into, but there are more. There are questions there. So I'll go over a general disability question, a broad activity limitation question, activity of daily living questions, ADLs, and functional limitation, or also called difficulties questions. But there are other types of questions, some questions getting at whether someone is receiving a disability benefit. There are questions about people's perceptions around their environment and how they perceive there are barriers in their environment, physical or social or other types of barriers. There are many other types of questions that I will not cover. I'll cover these 4 types because they tend to be the most commonly found in surveys and censuses. So the first one is a general question often formulated as, do you have a disability? And the answer could be yes or no, or the answer could be, if the answer is yes, there could be different categories listed, and often they have impairment types listed, impairments, so such as blindness, deafness, paralysis. So this type of question used to be very common in censuses in the 80s and 90s and even early 2000s. It has the advantage that it's a single question. However, the disadvantage is that, well, there could be a lot of stigma associated with disability, so people may not want to self-identify as having a disability or identify a household member with a disability. People may have different definitions of what a disability is, and often, especially if you include a list of impairments in the answers, people will only report very severe disabilities as a result. So prevalence rates with such a question tend to be very low, around 1 or 2%. So such questions are not ideal in the sense that they use a term that can be stigmatized, and they're not going to be able to capture the full population of adults with disabilities, but only those with the most severe ones. Another fairly common question, especially in surveys, is to ask people if they have a limitation in a so-called broad activity. So for children, it's about being in school. For adults, it's often about working or about taking care of others in the household. So for example, for adults, a common question is, are you limited in the kind and the amount of work you can do due to a health condition or an impairment? So again, the advantage of this question is that it's only one question. It's fairly intuitive. However, it's again, it's not going to capture all. It's going to miss out on a lot of people. Not everyone is aware of their health condition, especially if they don't have access to healthcare. And the barriers in the environment at work or to get to work are going to influence answers to this question tremendously. So in the end, it's unclear what is captured, whether we're capturing with such a question environmental issues, or whether we're capturing the prevalence of health conditions. Again, this has important limitations. For cross-country comparisons, especially because the work environment could be very different, and therefore there could be country-specific factors that influence the answers to this question, and thus limit cross-country comparisons, the ability to make cross-country comparisons. Another fairly common type of questions are questions around activities of daily living. They were developed for initially for older adults, and often they're found in surveys for adults 45 and above. There are two types of activities of daily living: the basic ones that are about self-care, for instance, feeding oneself, going to the bathroom, dressing without help. And then there are more less basic ones, the intermediate ones, such as carrying a heavy load or sweeping a floor. So such questions, usually they come in a group of questions. And you have the example here of the ADL questions in the Indonesia Family Life Survey, asking people if they could carry a heavy load, draw a pail of water from a well, walk for 1 kilometer. Again, here a challenge might be that some of these activities, especially the intermediate ones, may be hard to compare across country. Like drawing a pail of water from a well may have relevance in some contexts, but not in others, and therefore it would be hard to compare answers across contexts. Finally, there are functional/basic activity limitation questions. They refer to difficulties experiencing particular bodily functions such as seeing, hearing, speaking, or basic activities like self-care, taking a shower, for instance. So these questions are recommended by the United Nations Principles and Recommendations for Censuses of 2017. These guidelines recommend that there should be questions to capture disability in 4 domains: walking, seeing, hearing, cognition. And it also notes that 2 other domains, self-care and communication, may be covered in censuses. And these recommendations come very close to a short set of questions developed by the Washington Group on Disability Statistics. So with 6 questions that we had tested in different contexts, and do well across, did well in those tests in different countries, and thus are considered internationally comparable. So there are questions around seeing, hearing, mobility, self-care, cognition, and communication. So for instance, so it starts with an introduction. Because of a physical, mental, or emotional health condition, do you have any difficulty walking or climbing steps? And the answer scale has 4 points: no, yes, some difficulty, yes, a lot of difficulty, and cannot do at all. All right, so in these questions of the Washington Group short set are considered internationally comparable, and what we have done and what I'll talk to you about now is to what extent these questions are available worldwide. The Washington Group short set, has it been collected in many countries, many data sets? And are there other questions that are similar to the Washington Group short set, what I'll call other functional difficulty questions that have been collected? So maybe they're different in their wording. They don't exactly state, do you have any difficulty walking or climbing step? Maybe they ask about, do you have difficulty walking 1 kilometer? But they're still capturing mobility, and the questions still fulfill the United Nations guidelines for censuses. So we reviewed close to 1,300 data sets and their questionnaires from 188 countries to identify countries and data sets that had functional difficulty questions that had either the exact Washington Group short set or similar functional difficulty questions. So overall, we find that 2/3 of countries have functional difficulty questions in their surveys or censuses, but only 1 in 5 data sets have such questions. So we are far from having these questions systematically included in data sets, but there has been progress. So here's a map of the world, and in dark red, you see countries where we found data sets with the Washington Group short set. So that's a lot of countries in sub-Saharan Africa, but also in Middle East, North Africa, and in some countries in the Pacific, many countries in the Pacific, as well as North America. We also found that the other functional difficulty questions are available in many countries in Latin America, in particular, in Asia, and other countries here and there. And then the countries that are highlighted in pink, I would say, are countries without questions on functional difficulties in the data set we reviewed. So that's a lot of countries in Europe and Central Asia. So there are still countries where such questions on functional difficulties are not collected, and therefore it's hard to produce to have internationally comparable data on disability for those countries. We've also mapped the trends over time by region in terms of the availability of data sets with functional difficulty questions. So globally, there's been a lot of progress. The global line is in purple, and in the middle of this graph. So there has been progress since the early 2010s with more and more data sets with the functional difficulty questions, and with some regions doing better than others, like Sub-Saharan Africa and Middle East, North Africa, for instance, have seen tremendous increases in the proportion of data sets with functional difficulty questions, but it's less the case in, for instance, Europe and Central Asia or in South Asia. Okay, so given this increasing availability of data sets with functional difficulty questions, so we worked with many of them and tried to produce the prevalence rates and disaggregated statistics. So I included this slide again with an example of a question with the Washington Group short set question on walking or climbing steps and the answer scale. No, some difficulty, a lot of difficulty, and cannot do at all. So how should we categorize disability given this answer scale? So on the DDI website, there are results tables in Excel files, and you'll see that we produce results using three methods. So in disaggregation A, we compare people with no difficulty to people with any difficulty. So meaning any level of difficulty, people could report some, a lot of difficulty, or unable to do for at least one domain. So here we create two categories only. And in disaggregation B, we create three categories. The no difficulty is the same as before, no difficulty in all domains. Then some difficulties for people who report some difficulty in at least one domain, but do not have a lot of difficulty or unable to do in all other domains. And the third category is people with at least a lot of difficulty. These are people who answer a lot of difficulty or unable to do in at least one domain. So you can think of disaggregation B as in terms of putting people into maybe three groups: no disability, moderate disability, and severe disability. That's one way to interpret these categories. And then finally, disaggregation C. This is the disaggregation method that the Washington Group initially recommended. The Washington Group is open to other disaggregation methods, but initially recommended to put together people with no and some difficulty and compare them to people with at least a lot of difficulty. So people who answer a lot of difficulty or unable to do in at least one domain. Okay, so we present these big tables on the website in Excel files with those three methods, because we feel that users might want might have a preference for a particular disaggregation method. But in our reports, we have found and we have prioritized disaggregation B. We find it to be the most inclusive and the most comprehensive. And I'll show you why in a second. We also use disaggregation A by having a larger group of people with any difficulty. Sometimes it's handy if we need to look at some subgroups of people with disabilities, for instance, looking only at people with self-care difficulties. We may not have much of a sample size if we split by level of difficulty, but if we put people with any level of difficulty together, we might be able to zoom in on people with self-care difficulty. So we find disaggregation A useful, and we find disaggregation B inclusive. Well, first, because if we look at prevalence rates, so these are results from our 2023 report using DHS demographic and health survey data for 12 countries and census data for 3 countries. Prevalence rates are represented in this bar chart. In dark blue, you have the proportion of people with adults with some difficulty, and in red with horizontal lines, people with at least a lot of difficulty. So there are a lot of people with some difficulty. and in every country, they are the majority of people with functional difficulties. And what we found repeatedly across countries, and that's for the 23 report, but also from earlier reports, so that's total more than 70 countries, we found that there is a gradient in inequalities between by the level of functional difficulty, meaning that people with some difficulty tend to be worse off than people with no difficulty, but they are better off than people with at least a lot of difficulty. So that's represented in this chart. Here you have the proportion of adults who have ever attended school. And the top of each bar is the proportion who have ever attended school among people with no difficulty. So that's the top of the light blue bar. And then in each bar you have dark blue. You have dark blue, the bottom of the bar. That's the ever attended school rate for people with at least a lot of difficulty. And then above that, with the next blue, that's people with some difficulty. So you see that people with some difficulty have ever attended school rates that are right in between people with at least a lot of difficulty, who have the lowest rates, and people with no difficulty have the highest rates. And this gradient in terms of the relationship between the severity of the functional difficulty and the inequalities that we find, we also find it, so we find it systematically for educational attainment outcomes. We also find it for multidimensional poverty. For other outcomes, maybe it's more mixed. But for multidimensional poverty rates, here you have here, this is the proportion of adults who experience more than one deprivation, meaning that they could, for example, they could have less than primary school completion as their highest educational attainment, as well as not being employed. Or they could be not employed and not having adequate housing. All right, so this is the gradient. So for this, because of this gradient, we feel that it's very important not to leave out people with some difficulties, to include people with moderate, so some difficulties, moderate disabilities in our disaggregated statistics. So finally, I know I'm almost out of time, but I'll go over a couple of questions that we've been asking ourselves. So we have, Disability Data Initiative has many collaborators in different parts of the world, and we are together working on these, not only reviewing data set questionnaires, but also producing disaggregated statistics. So one question we've been wondering about is, what are the advantages and disadvantages of censuses versus surveys to produce these statistics? So censuses have the advantage that we have the entire population. For some countries, we do have the data set for the entire population. Often we have a large sample, for example, a 10% sample that is considered largely sufficient to have representativeness at the national, regional, as well as district levels. And also with a breakdown of indicators by disability combined with other demographic or socioeconomic characteristics like gender or rural, urban residents, age groups, etc. Of course, censuses are infrequent, often once a decade, and they're very resource intensive. There may not be enough resources towards training on disability questions, and we know how important training is. The type of language that is used, for instance, to ask the question is very important. So training is very important and may not be feasible when, for such a large data collection exercise. Surveys have the advantage of being more frequent. Maybe they have more resources for enumerators training. However, their sampling may not be designed to be representative of persons with disabilities. So one question we've been asking ourselves is, for some countries, we are lucky to have multiple data sets with functional difficulty questions. So in this case, which estimate do we pick if we see a wide variation in the estimates? Or should we pick an estimate? And perhaps it's better to present all estimates and some background information for users on why the estimates, maybe let's say for Cambodia, why the estimate from the demographic and health survey and the estimate from the census survey on prevalence rate may be vastly different. So I look forward to your thoughts on this during the Q&A. Another question we've been asking ourselves is disaggregation by disability combined with another, so demographic characteristics feasible? So could be gender, residence, or age group. So what does feasible mean? So in our estimates, we have, so in the 23 report, we've used a minimum sample size of 50 for the subgroups. So for any group that we produce an estimate for, so for instance, it could be people with at least a lot of difficulty and residents in rural areas. So for these groups, we consider 50 observations as the minimum to produce an estimate. And with this minimum, we have been able to produce disaggregated statistics for subgroups. So we've been able to do it for women, men separately, rural and urban residents, and with 4 age groups separately. So we have often been able to produce these double disaggregations, but for some indicators, we have not, given small sample sizes. At the subnational, we asked the same question: can we produce these disability disaggregated statistics at the subnational level? So that's a question we focus on in the 23 report. So we use data for census data for 3 countries, Guatemala, Kenya, and Tonga. And here we considered, we produced disability disaggregated statistics at admin 1 level, the regional level, and admin 2 level, the district level in each country. For demographic and health surveys for 12 countries, we produced disaggregated statistics at admin 1 level, at the regional level. So that was possible. So we had 50 plus observations for each subgroup, so each region, for indicators based on questions in the household roster questionnaire of the DHS, but not from questions that came from questionnaires for specific respondents, like the women questionnaire or the men questionnaire. So we did not produce subnational estimates for employment or family planning or gender-based violence indicators. Well, here you have some of examples of the 2023 results at the subnational level, and you have results for Timor-Leste. So here you have 3 maps of Timor-Leste. So each map represents the multidimensional poverty rate. The lighter the blue, the lower the rate. So on the left-hand side, figure 1A is for adults with no difficulty. The center graph for adults with some difficulty. And on the right side, figure C is for adults with at least a lot of difficulty. So, well, with adults with no difficulty, there's quite a bit of variation across regions. With one region with multidimensional poverty rates in the 70% range. But for most regions, the multidimensional poverty rate is more around in the 50 or 60% range. In the middle chart, you see that it's more homogeneous around across regions, that people with some difficulty tend to have multidimensional poverty rates that are elevated compared to adults with no difficulty, and they tend to be in the 70 or 80% range. And on the right side, you see that for almost all regions, people with at least a lot of difficulty have very high multidimensional poverty rate in the 90% range in most regions. So here it's an illustration of the gradient I mentioned before, but here you have it illustrated at the subnational level for Timor-Leste. And as another example, here you have a map of two maps of Guatemala. So these results are actually for this map only. We produced estimates at the municipality level, admin 3 level. And these maps are about the gap, so the difference in multidimensional poverty headcounts between adults with no difficulty and adults with some difficulty in the left map, and adults with at least a lot of difficulty in the right map. So here again, we see the gradient illustrated with darker red colors on the right side, so suggesting that adults with at least a lot of difficulty are a lot worse off compared to adults with no difficulty relative to adults with some difficulty in the left map. Okay, so to conclude, and thank you for staying here throughout all those slides. Household surveys and population censuses can and should be regularly used to collect data and to document and understand the inequalities that people with disabilities experience, as well as some of their subgroups by gender, residence, and age at both national and subnational levels. So we know now, with considerable progress, thanks to the international work of the Washington Group on disability statistics, we know how to collect the data. We have many data sets, more and more data sets with questions on functional difficulties. So, but there's a lot of work in terms of now using such data sets to produce disaggregated statistics. So national governments as well as international organizations need to allocate more resources towards disability data analysis for national statistics offices, as well as other stakeholders to do the analysis for this growing body of data that can help document the rights of people with disabilities and as well as their situation in the context of Agenda 2030. So here you have the documents that this presentation is based on. You have the 23, I mostly use the 2023 and the 2021 disability data reports. And I also used regarding where to set the cutoff and how to create categories of people with disabilities for disaggregation. I used this commentary by Hannes Hancock and co-authors. Thank you very much, and I look forward to your comments.
Sophie, thank you so much for this very insightful presentation, very detailed, very fascinating. It must have been a massive effort on the data disability initiatives and to go through so many data sets from so many countries to distill all these analysis. And I think it's really very useful to kind of see the clear correlation that you show between the severity of disability and the quality of life, education attainment, and so on and so forth. It's super clear, and this is certainly something that is very useful to hopefully drive action and drive policy. I have now enabled the cameras and the microphones for all the participants. Please do feel free to raise your hands if you have any questions for Sophie. I see a hand from Siraj. Please go ahead and ask your question.
Thank you. Thank you, Sophie, for the presentation. I am in the UNICEF Regional Office for Europe and Central Asia. I think we were in touch through Mark at some point about disability data. Two things. One is absolutely agree about at least the use of existing data. We will also be bringing the inequity data, including by functional difficulties, in an inequity dashboard using mixed surveys in the region. All the recent surveys, we will be putting this in a public domain very soon on our TransMoney website. Second question is, you mentioned about the region, the European part, and lack of the use of the Washington Group. One reason, of course, is that it is mostly GALI, the Global Activity Limitation Indicator, that is used, right, in the youth pilk, in other surveys. And there are practical, of course, reasons for that, because it's very short, 2 questions, I don't know, it's 3. But then could you please elaborate a little bit on, by using that, what is that we are losing in terms of, especially, of course, my concern is children, functional difficulties among children, but could also be adults. Do you have an experience with using and comparing the data using different methodologies? Thank you so much in advance.
Thank you, Siraj. Sophie, please go ahead.
Yeah. I have not directly compared. That would be a great project, actually, to find a data set which has both the broad activity limitation question, like the GALI, as well as the Washington Group short set, and compare. That would be great. My understanding is that with broad activity limitation questions, it's hard to make comparisons across countries. Maybe within a particular region of the world, maybe that's okay. But using the GALI, especially if it's been tested in different countries in Europe, Central Asia, maybe that's okay for the purpose of comparing the situation of countries within a particular region. But internationally, I think my understanding is that questions such as the Washington Group short set have been tested in many parts of the world, and they refer to basic life activities that are intuitive for people to understand, no matter where they live, or functional questions like seeing, hearing, that are easy to understand no matter where people live, and might do a better job when it comes to producing international or global statistics. And you mentioned children. Well, for children, I don't know, I don't think I clarified that, but whatever I showed you is for adults 15 and above. So for children, we did not produce statistics for children. UNICEF is doing a lot of work in this area, and is in particular with mixed data, the multiple indicator cluster survey that has the child functioning module with many more questions than the short set, that is in a better position to capture disability in children, which is more tricky than among adults, because children develop and change rapidly. Yeah. And I'm not sure that answers your question.
No, thank you. Yes, it is something, again, we also would like to continue comparing towards the measure that is used, but also the source, right? What if, I think Arianna put it, the modules to be used for children. What if the adult module is used for children in the censuses? We believe it is underestimating the functional difficulties among children, but it would be good to of course, continue the analysis to understand census versus surveys. Who is the respondent? If it is the questions about children, they play a big role as far as we understand it. Thank you so much.
Oh, you're welcome. And then there's a question about psychosocial disabilities.
Yes.
Should I answer that?
Yeah, let me read out the question, and then Sophie, you can take it. Ariana posted a question about how well does the Washington Group short set capture psychosocial disabilities? Is there any analysis on this available?
Yes, so yeah, there has been some analysis on this. It's not going to capture a lot of psychosocial disabilities. And for that, the Washington Group has developed other questionnaires. And for that, to be more comprehensive in terms of the domains it covers and go beyond the 6 domains of the Washington Group short set. So you have the enhanced questionnaire of the Washington Group short set, as well as the extended ones. These would do a better job at capturing psychosocial disabilities. So there are other questionnaires tested, developed and tested by the Washington Group short set. We have focused on the short set because that's what is the most widely available. That's what tends to be included in censuses because of how concise it is. Yeah, but there has been work on these, using these other more comprehensive questionnaires.
Thank you, Sophie. Let's take a few more questions from the floor. Please do raise your hands if you have any for our speaker. I don't see any hands now. Maybe I can ask one question that kind of popped up into my head as you were going through your conclusion slide. Sophie, you were talking about encouraging policymakers and international organizations to pay more attention to producing disaggregated data by disability status. So, I mean, it's clear that the level of disaggregation that's being done right now is insufficient. And I wonder if that is a result of a lack of consensus on how to kind of define disability, as you've kind of briefly mentioned in your presentation, or it's a result of a general lack of effort, a recognition that doing disaggregated statistics, official statistics by disability status is something that is important. So is it a general issue here, or is it due to mostly a technical lack of like consensus on how to define disability, or both?
Yeah, that's a bit of a tricky question. Yeah, disability can be defined in many ways, but at the empirical level, if we at the empirical level, we have tools. Again, thanks to the Washington Group's work, we now have tools that do a good job internationally, and that are compatible with contemporary definitions, like a human rights definition or an interactional definition. So I think if people can think of disability and maybe practically using these questions that we have in those tested questionnaires, I think that's progress, because people think, okay, now we know how to ask the questions, but then the challenge is how to use them. So I think there is a lot of work to do in terms of developing the art of using these questions and doing how to do the disaggregation. But there's also capacity building to do. So maybe awareness among policymakers that this can be done, but it needs people, capacity building among our analysts in terms of learning how to disaggregate. And but it can be done. Yeah, so I think the lack of awareness and lack of prioritization. Yeah, that would be my answer.
Yeah, thank you. And it seems that the availability of data itself is improving day by day, but it's making use of the data and producing something useful out of it that is still an issue. So I do agree that's probably some quite low-hanging fruits that could be dealt with if there are concerted efforts to focus on that particular issue.
Absolutely. And there are countries that are making good use of their census data. So it can definitely be done. Like if you look at, for instance, Tonga has been collecting the Washington Group short set in their censuses in 2016, 2021. In 2016, they analyzed their data in a monograph. So some governments have been, dedicating resources to provide a supplemental analysis of the census data. So it's not going to be in their main report. Maybe their main report will have only a couple of tables, but they do allocate resources to do more in-depth analysis. Yeah, so it definitely can be done.
Excellent.
Yeah.
Any other questions? Everybody on the call, please do raise your hands. So just unmute yourself and turn on your camera to ask your questions. I think Ariana has another comment, a question. Ariana, I wonder if you would like to kind of ask it live, or do you prefer that
Sure. Sure.
Yeah, go ahead.
It's more of a curiosity. Thanks for this initiative. WHO reports, the latest one indicates 16% of persons with disability worldwide, but in the map you just showed us, it shows that there's very different standards on how disability prevalence is being collected in all different countries. So I was just wondering if you're aware how this figure is put together, considering these discrepancies in data collection.
Yeah, so you're right. So the 22 estimate of WHO is 16%. I believe their earlier estimate of 2011 was 15%, but they do not use data on functional difficulties to come to this global estimate. I believe they use data from the Global Burden of Disease study. So which collects a lot of data on health conditions, prevalence of health conditions worldwide, and does some modeling on how such health conditions might impact people's lives. So it's a very different methodology, and therefore not grounded in the data I showed you. Yeah.
So maybe as a follow-up question, given also the extensive work of analysis you've done in the past years, do you think if they were to use the Washington Group short set or something similar, or like a functioning approach, would it be higher, lower?
That's a great question. So so far in our work on the prevalence rates, we have not felt we had enough data. So we covered enough of the population of the world or population of a particular region to be able to produce a global estimate. But however, what we in the 21 report, because we covered many countries, more than 40 countries, we presented a median prevalence rate among all the countries, and I think it was around 15%. So, it's different. It's a different type of data we use, and our data is not global at this point, but it didn't seem very far, actually, overall. Yeah.
Maybe one very last question from me. The Disability Data Initiative is definitely very useful, and I encourage everyone to really go to the website, which I posted in the chat, to look at the reports and at all the data sets as well. As principal investigator, Sophie, what are the future directions of the initiative? What can we look forward to in future editions of the report?
Thank you.
Anything exciting you can share with everybody?
Thank you very much. That's a great question. Well, we're open to suggestions. So if you do have suggestions, whether now or later, please reach out. Right now, we are focused on consolidating our results and refining our methodologies, and hopefully we will soon have put together our results into a database of disability statistics. So that's one. And then for other potential focus in the future, we'd love to consider changes over time. That's only possible for those countries where we have at least two data points. So that limits the scope of the analysis very much, but that's something we'd like to to try and do. Yeah, and we are open to your ideas for thematic or other focus. Yeah.
There you have it, everyone. So if you have any suggestions or comments or ideas, do feel free to reach out to Sophie and to the Disability Data Initiative. Let me, at the end of this session, let me really thank our speaker, Sophie, who takes time to talk to us today. We headed towards the holiday period, so I know that it's a sacrifice to take an hour to come and talk to everyone, and really appreciate it. And a couple of things that I want to bring up before we end. First of all, this is the last Global Network webinar for 2023. We have had a very productive year at the Global Network with quite a few of this global webinar series being put together, and we really enjoyed interacting with all our speakers and very appreciative of all the participants for tuning in. I think we have somewhere around 2,500 people tune in collectively for this year. So we appreciate your time and your engagement. And for those of you who celebrate very happy holidays from all of us at the Global Network, and we look forward to seeing you again at the beginning of 2024, where we have a full slate of programming again scheduled for the year. And secondly, if it's not too much of a trouble, can I ask for a small favor from all the participants? May I invite you, if possible, to unmute yourself and turn on your cameras and join me in giving Sophie a big round of applause for her presentation.
Thank you all for being here. I really appreciate it. And thank you, Panya, for organizing. Thank you.
Thank you so much, Sophie, for your time. Thank you, everyone, for your participation.
Bye-bye.
Happy holiday. See you
Happy
next
holiday.
year.
Bye-bye.
Bye.